Though you've done all the right things, you may still unknowingly be exposed to germs, and some people will still become ill, whether it's the common cold or other serious illnesses like the flu. What exactly is influenza or the flu anyway? Influenza is a contagious respiratory illness. That means it involves your breathing system. It is quite often confused with the stomach flu, which doesn't affect your breathing system. It can also be confused with the common cold, but the flu is quite different. The flu is not to be taken lightly. The flu circulates and causes seasonal outbreaks every fall. The fact is that thousands of Canadians die of the flu every year. How do you know if you have the flu? You will start to feel symptoms of the flu 1 to 3 days after you're exposed to the virus. People may infect others a day before they even have any symptoms. Whether you have a cold or the flu, you might experience symptoms such as a runny or stuffy nose, sneezing, sore throat, fatigue, or chest discomfort. If you have the flu, you will likely also experience a high fever that comes on quickly, chills, cough, a severe headache, extreme fatigue, and aches and pains. Some people, especially children, may throw up and have diarrhea when they have the flu. Pneumonia and respiratory failure can be a complication of the flu, and chronic illnesses can become worse. We have all heard things about the H1N1 flu virus. It is a new strain of influenza that has spread across the world. That's why the World Health Organization declared a pandemic in June of 2009. There is some evidence that people born before 1957 have some degree of immunity to the virus. No one knows the extent to which this new flu virus will spread. We can all do our part by practicing the same prevention strategies for stopping the spread of all germs. People experience the same symptoms with H1N1 flu as they do with seasonal flu. So, does everyone with the flu need to see a healthcare provider like a doctor or a nurse practitioner? Not everyone will need to see their healthcare provider when they have the flu. You should see someone if your symptoms get worse and you do not start to feel better after a few days. But there are people who should see their doctor if they have the flu. Pregnant women, people with heart or lung disease, people who have a chronic health problem that requires regular medical attention, elderly or frail people, people who have an illness that may affect their immune system, for example, diabetes, cancer, or HIV/AIDS. Telehealth Ontario is a free telephone service with registered nurses available to answer your questions 24 hours a day, 7 days a week. 1-866-797-0000. How do you know when to get medical care? If anyone has symptoms that were improving and then suddenly become worse, they may need immediate medical care. Some other signs that indicate immediate medical care may be needed are fast or difficult breathing or wheezing, bluish or dark-colored lips or skin, the person becomes confused or hard to wake up, seizures, dehydration. Symptoms of dehydration to watch for would be the sick person may be dizzy when they stand up, and they may not be urinating, and dehydrated infants may not have tears when they cry. Very young children may be severely cranky or not want to be held. When children have the flu, it is important to monitor their symptoms and check on them frequently. Much of the time, taking care of yourself at home can relieve many symptoms. If you get the flu, there are things that you can do. Drink lots of fluids like water or 100% juice. Avoid drinks with caffeine, as this can actually make you lose fluid from your body. Avoid alcohol. Avoid smoking. Take basic pain or fever relievers like acetaminophen, for example Tylenol, or ibuprofen, for example Advil. Do not give acetylsalicylic acid, or ASA, for example aspirin, to children or teenagers under the age of 16. To reduce muscle pain, apply heat carefully for short periods of time using a hot water bottle or heating pad. For a stuffy nose, use saline drops. To ease a sore throat, gargle with a glass of warm water or suck on hard candy or lozenges. Get lots of rest and take care of yourself. Whether you or someone else in your home becomes ill, there are some important things to keep in mind. Have we mentioned keeping your hands clean is important? Again, it is one of the most effective ways to stop the spread of germs. Anyone who is sick with the flu will be contagious for several days after their symptoms start. If possible, try to keep the sick person in a well-ventilated room of their own and avoid contact with the rest of the family. Of course, keep a close eye on sick children. Throw any tissues away immediately and wash hands. Ill people need lots of rest. Don't have visitors in the home. Clean objects and surfaces after the ill person uses them, because the viruses can survive on some surfaces for 2 days. General disinfectants are all that you need. Make sure that the sick person has their own towels, cups, and utensils, so their germs are not spread. When holding a small child who is sick, place their chin on your shoulder so that they do not cough in your face. Pregnant women should avoid providing care to people sick with the flu. Other people living in the home should watch for symptoms of the flu. If you are alone or a single parent, or responsible for the care of someone who is elderly, frail, or disabled, and you have the flu, call someone to help you until you are feeling better. Now you know how to stop the spread and what to do if you get sick, but wait, there are a few more things you should consider. Make sure you have a list of phone numbers for family, friends, neighbors, your doctor, and telehealth available by your phone. Plan for other child care arrangements in case your child becomes ill and will not be going to school or daycare. It is always a good idea to have extra supplies at home in case you are ill and cannot leave your house. Always keep some extra non-perishable foods like juice, canned soup, and fruits and vegetables stored at home. Consider stocking some extra items such as tissues, regular disinfectant cleaning supplies, a thermometer, liquid soap, alcohol-based hand sanitizer, and basic pain and fever relievers. Make sure you have several days' supply of your regular medications on hand. Teach children and others in your life how to stop the spread. Do your part. Keep germs away every day.